A patient produces 1250 ml of urine in 24 hours. So how many liters? So remember, it's 1.25 liters, isn't it? Because you see, as 1000 ml is equal to 1250 divided by 1000. 1.25 liters. So 1.25 liters of urine produces. Next, a patient has been prescribed with 800 mg. So 800 mg is the doctor's order. You need to be dividing this with the stock in hand, that is the 200 mg tablet. So you are going to give to the patient 4 tablets. And the next question is, patient has been prescribed with the 100 mg. So always try to have your calculator on with you. Have practice with your calculator. So 100 mg is the doctor's order of amitriptyline hydrochloride solution, and the stock in hand you are having is the 25 mg. And the total volume means 25 mg in 5 ml, right? So you are going to administer the patient with the 20 m small capital L, 20 ml. Then the next question is, a patient has been prescribed with 600 mg. So this is the doctor's order. You are going to give 600 mg to be divided by, here comes the divided by 250 mg. So the 180 mg you are going to divide it with 30 mg, that is the stock in hand, multiply with the volume 5 ml. You will get 30 ml. We are going to administer it to the patient. The patient has been prescribed with 36 mg of codeine phosphatase. So 36 mg to be divided by 60 mg, which is the stock in hand, multiplied by 1. So that is the same 0.6 ml. We are going to administer it to the patient. A patient has been prescribed with 8 mg. So always have 8, doctor's order, divided by what volume should be drawn up from the injection. Please use the correct unit and the decimal, means we need to mention all. So 8 is the doctor's, divided by the stock in hand, that is the 5 mg, multiplied by 1. So we are going to administer 1.6 ml to the patient. Next question is, here remember, when it's mentioned with the doctor's order 1.5 mg to be given per kg, right? So the patient's weight is 80 kg is given. So this whole to be divided by the 50 mg, which is the stock in hand, and the volume is 1, so multiply by 1. So we are going to administer 2.4 ml to the patient. Here 5% dextrose, date root, what would you set the infusion pump to run? So 750 ml to be. So here 750 ml we are going to give for 750 ml to be given for 6 hours. Here the formula we are going to apply is total volume of fluid to be given in hours. There is no minutes, and also we are not going to multiply with anything. So 125 ml per hour we are going to administer it to the patient. Another question, what would you set the infusion pump to run? Give the answer nearest to the whole number. So here you see 700 ml to be administered, 700 ml of 9% sodium chloride to be administered it for 8 hours. So 700 ml, that is the total volume of fluid to be administered in 8 hours. So we are going to get 87.5 as the 0.5 So here as the point 0.5 number is more, when we are going to multiply 700 to be divided by 8 hours, then 87.5. The nearest number you can either give 87 ml or 88 ml. So 88 ml per hour. Next similar question. Here Gelofuscin 800 ml to be given for 10 hours. What rate you will set the infusion pump at? So 800 ml to be given for 10 hours. So you are going to administer 80 ml per hour. So here it's most difficult question. Here you see, you need to mention with positive or negative plus ml. So if you are going to miss either positive or ml, so here we need to add up all the answers. So here 150, 150, 300 ml, 300 plus 140, 450, 450 plus 100, 550. So 550 plus 1234 plus 400. So you are having input of 950, and the output, coming to the output, 200, 300, 350, 350 of output plus 75 ml. So then 80 also was the output from the patient. So here you got 505. So what might be the answer for this question? Please leave your answer in the comments below. Thank you so much.